Hello. Hi, this is Dr. Chefu. Thank you for joining me today live. We're going to be talking about 10 pressing questions people want to know about hair transplant. So I hope everyone can hear me. So usually, how did I come about the 10 pressing questions? I mean, people sent in questions and there were 10 of them. So I'm like, okay, I'm just going to say 10 pressing questions you want to know about hair transplant. Hopefully, I'll be able to cover the 10 of them. If not, we might make a part 2 of this, okay? So we're going to start with all about hair transplant and all that. Hopefully, I'll be able to explain it that everyone can understand it. And if you have more questions, just, put it in the comment below and we go from there, okay? So let me read the questions. I have it written down in the paper, okay? So I'm using my phone. Obviously, I'm using my phone to record today. So I'm going to read the question. So someone asked a question here, says, can you let us know about the 2 types of hair transplant, okay? And which is the best? So I don't know, I've made a video about this. So we have 2 basic types of hair transplant. Let's understand the meaning of a hair transplant. Hair transplant is you're transplanting good hair to area where there's hair loss, okay? So we transplant hair follicle to area where there's hair loss, usually to the front, to the side, or to the crown, okay? So it's a type of medical treatment, or we can say surgical treatment of hair loss. So for hair loss, we have the medical treatment and we have the surgical treatment. So if we understand that basis, so we can go moving on now to what hair transplant the types we have. So we have 2 types. We have the strip surgery, which we call the FUT. From the name strip, we take a strip of skin from the back of your scalp and we slice the follicles and move it where we need it to be. That's strip surgery, taking a strip of skin. Simple. Now, the other one is called FUE, okay? Follicular unit extraction. What does it mean? You're extracting the follicular units, okay? You're extracting it. So what am I trying to say now? So under the extraction, the FUE, we use different machines to do the extraction. So no matter what clinic you go to, they tell you Artus, Zeus, Travellini, Wow, no matter what they tell you, what machine, they're just doing what? FUE, okay? So we have FUT and FUE. Now, someone is going to ask, so that's the question someone asked me now. Which one is the best? So I wrote a couple of things here. Number 1, which procedure is the best? You have to, first of all, medical history is very important. What is the person's medical history? Okay, any chronic illnesses going on? Is the person on a blood thinner? So those medical history is very important. Is the person so for Afro-textured hair, some people are prone to keloids. So medical history is very important, okay? So medical history, number 1, then patient preference. Some people want to wear their hair short. Some people want to wear their hair long. So it depends on which patient's preference, okay? So medical history, patient preference, and price point, okay? Prices differ. FUT is a little bit cheaper than FUE, okay? FUE is more demanding. So FUE is more the advanced technique now. Most clinics do FUE, but we still have FUT and FUE. Sometimes we can also do combined FUT and FUE. Remember, FUT is the strip surgery. FUE is the follicular unit extraction that we use different machines for. Okay, so the factors that come into play before you choose what procedure you want to do is number 1, medical history. Number 2, patient preference. Number 3, price point. Number 4 is availability. Okay, how much hair do you have at the back of your scalp where we need the hair, where we need to pull the hair from? So these are the 4 factors. Now, do you need to make the decision? No. Your hair transplant surgeon makes the decision, okay? Short, sweet, and simple. So your hair transplant surgeon makes the decision. So that was the first question. Then the second one, I got a lot of questions about scarring, and which procedure gives you scar. The number 1 rule of thumb that they always tell us in ISHRS is no matter what procedure you do, whichever one you do, either the FUT or the FUE, you never tell a patient or a client that there's no scar, okay? So that is something we're always supposed to tell our clients. Now, do some people have scar? No, but I cannot tell you that you won't have a scar. Okay, so let's move on. So they said, so that was the first question about which one is better, either FUT or FUE. It doesn't really matter. It depends on the physician's expertise to what they can do. Now, the second question they asked was post-transplant hair guarantee. So what are they trying to say? This was a question. They said, what is the guarantee that you can give to a client after a hair transplant that their hair is going to grow? I get this question a lot. So I always try to break it down. I have a three-factor. The way I break it down is a three-factor reason, okay? So the first factor is your physician, the physician you choose, the hair transplant physician you choose, okay? You have to read up on the hair transplant physician. You have to find out if the person is also part of ISHRS. You can go to ishrs.org and find out the physician you're choosing, what they can do. So you have to do your research, basically. So that's number one. Number two is patient compliance. What do I mean by patient compliance? We have pre-op, that's pre-operative instructions. So before you have a hair transplant, the doctor is going to give you a list of things you cannot do. Like this, you have to follow it to a T. You cannot do, okay? So that's pre-op instructions. Then we also have post-op instruction, post-operative instructions, okay? So you have to understand, if you have to have a hair transplant, some physicians will make you sign after going through all those instructions. Some physician will make you sign because you have to understand that, hey, I've done my own part by doing the hair transplant. Now you have to do your own part by following the post-operative instructions, okay? So we talked about what is the guarantee. So there's physician part, then there's patient or client part, which is what? Following the pre-operative and post-operative instructions, okay? Now, the other one I always like to say is unforeseen circumstances. What I'm saying, I mean, nothing is 100%. So even though you do everything you can and the physician does everything they can, sometimes there are unforeseen circumstances there. Hey, okay? So that is the guarantee. Physician part, client part, and unforeseen circumstances, okay? So that's number two question. Now, they said, how long do I have to wait? Do I see the result after a hair transplant? Okay? So they said, how long do I have to wait for me to see the results of my hair transplant? So when you come in, we talked about post-operative instructions. Part of the post-operative instructions is we give you timeline. There's a timeline. The first day, the second day, 1 week, 2 months, you know. So we give you a timeline of events. Okay, so typically you expect to see some result from 4 to 6 months. Time is here. You need patience. Whatever treatment you have to, when you're on a journey, you have to be patient, especially with hair loss. You have to be patient, okay? Because most people after the hair transplant, they're worried. I can't see the hair. My hair is falling off. My hair is doing this. You have to be patient. As long as you've done everything, your post-operative instructions, what they told you, as long as you've done all that, you'll be good, okay? So it's patience, okay? Just document your process, document your days, document everything, and you're going to see the journey, okay? So that's it. So how long do you have to wait before you have to start seeing something for the 6 months, but the full result, you see it in 12 months, okay? 12 good months. So you have to wait. So that's it. So they said, factors. Somebody asked me, what are the factors that can affect the longevity of hair transplant? So what are the factors? I mean, I think I've kind of gone through the factors. So we talked about non-compliance with your medication, especially medication for hair loss. Because remember, we have the medical treatment and we have the surgical treatment, okay? So both of them go hand in hand. So you have to be compliant with your medication. You have to be compliant with what? Your pre-op instructions and your post-operative instructions, okay? And medical history, especially chronic medical conditions like autoimmune, okay, those can also affect or if you have scarring alopecia, because sometimes we also do hair transplant with scarring alopecia. So these are factors that can affect the longevity, okay? Usually hair transplant, I can tell you that it's permanent, but there are factors that can affect it, okay? So that is that for that. Then someone asked me a question, is there cases where the transplanted hair fails to grow or maintain density, what do you do? Okay, so anyway, that was the question. It said cases where transplanted hair fails to grow or maintain the density. Okay, so what I think I've also talked about is, so for you to make sure that you don't give into any chances so that you don't lose any hair, you have to be on medical treatment before and after your hair transplant. So medical treatment is one part, surgical treatment is the second part. Medical treatment, being on your finasteride, being on your minoxidil, then your surgical treatment, which is the hair transplant. Then you continue your medical treatment. So you have to make sure those two are joined together, okay? So that's it. So that's how, now, hair density, I don't want to go into more medical terms and all that, so I'm going to leave the part of hair density. Anyway, for us to measure someone's hair density, that's part of your hair evaluation. We measure your hair density in the area of hair loss and also in the area where we're going to take the hair from. So the hair density is more calculations and all that, so we're going to leave there for hair density. So let's see what other questions she has. Okay, I got a lot of questions about scarring in hair transplant. As I already mentioned when I started the live, we never tell clients that you will not have scar. The only one I'm afraid of is people that are prone to keloids. That's one thing I always look out for, keloids, okay? Especially Afro-textured hair, some ethnicity, they are prone to keloids. So I have to ask that question. I have to ask you, have you had any injury, wound in the past? How did it heal? Okay, so I always ask that question. Any history of keloids and all that. So that's I'm concerned about keloid. But for scar, is a whole broad topic talking about scar. Okay, so either you do an FUE or an FUT, you are prone to get scar. Okay, you're prone to get scars. But FUT, now let me explain the difference between the scars you get. FUT, like I said, is a strip surgery. We take a linear, a strip of skin. And you can see when I take a strip of skin from the back of your hair, what happens? You take a strip of skin, you close up the skin, and what happens? You have a linear scar. Okay? You take a strip of skin, you close up the skin, you can have a linear scar. Now, some people heal nicely and you don't notice it. Now, when do I tell you to stay away from FUT surgery? Now, if you want to wear your hair short, like really short, like men, you might not want to do FUT, okay, because it might probably show. Now, if you've already done FUT in the past and you have a linear scar, we can close it up. There's a way we can, hide the scar. And that's where SMP, which is scalp micropigmentation, comes into play, which is also called hair tattooing, okay? So we can basically use ink and shade off that area of scar. And most people won't notice that. Most people are really happy with their results, okay? So we'll talk about scar. FUT, you have a linear scar, okay? But now we have more advanced techniques. When we do FUT now, you might not even notice the scar. So we have more advanced techniques now. So for FUE, like I explained, we're extracting, it's follicular unit extraction. We're extracting individual hair, okay? Individual follicular unit. We're extracting it. We use a machine, call it a motorized machine, or it can be manual too. So imagine if we're going randomly extracting hair from the back of your scalp. Remember, we're extracting hair. What kind of scar are we going to leave? Pinpoint scars. That's what we leave, okay? Pinpoint scars. There's a whole mathematics to this and calculation on how we do it to avoid, these scars, the pinpoint scars, to be together, to be close together. So like I said, the FUT, linear scar, FUE, pinpoint scars. Okay, so how do we avoid that? I know most physicians, most hair transplant physicians now, we use tiny punches. Okay, we have different sizes of punches. We have the big ones and we have the very small ones. Okay, so we use tiny punches, tiny punches, almost like a needle, like, you know, very tiny. So why do I say that? If we use tiny punches, you don't even notice it, and we randomly pick out the hair that we need to transplant. Okay, randomly. So when it comes to scar, it depends on what type of procedure you get. If it's the follicular unit extraction, or if it's the FUT, which is the strip surgery. So these are all part of your consultation when you come for hair consultation. Okay, that's why I encourage come for hair consultation, so that the doctor, the hair transplant surgeon, can take a look at your scalp, take a look at your hair, take a look at everything, and you can make the right decision. Okay, so we talked about types of hair transplant, talked about the types of scar, talked about what are the factors that can affect your hair transplant, the results of your hair transplant. We talked about that. Then we also talked about when do you choose, give me a second. Okay. Now we talked about when do we choose which one, which type of hair transplant. And I said there are so many factors, okay? Medical history, patient preference, price point, and availability. So we went through that. Let me see if there's any other thing I'm missing. And we talked about when do you start seeing results, okay? You start seeing results 4 to 6 months, then you can see the full result in 12 months. Now, another question is, people want to know that, what about the swelling that comes with hair transplant? You know, you see all these videos on Instagram, on YouTube, and all that. So everything depends, okay? Everything depends on the physician technique, how they did the hair transplant. So I'm not going to go telling you the swelling. The swelling usually depends on how much fluid they used during the hair transplant. So with the swelling goes down, and this is part of your post-op instructions. We tell you how to, you know, lay on the bed, tell you how to position your head, make sure, you know, these are all instructions we have in our post-op instructions. So now you know most of the questions. We might likely have a part 2. So if you have more questions for me, send me a DM, okay? Call us, email us, and I will answer those questions. So a couple of things that are coming up is that we're going to have our first web series coming up. That's number 1. Hopefully we're going to start in May, our web series all about hair transplant and hair loss. So that's number 1. Then number 2, we might have some practicals coming up in our clinic about post-hair transplant, how to care for a client. How to care for a client after hair transplant. I think it's going to be coming up. We're going to have 2 batches, likely one in May and one in December, hopefully. December, yeah. So we're going to have like in-clinic practice, like, you know, how to care for a client. So if you want to know more about that, email us, text us, call us, and but we're gonna be releasing the dates soon. The dates are gonna be coming up soon, so watch out for that. Then I'm gonna be having an interview with Dr. Pepper. Dr. Pepper is gonna be coming on next week on 28th, January 28th. Hope I'm not wrong. Yes, 28th. And we're gonna be talking about everything hair loss, how your weight affects your hair loss. Okay, so tune in. We have so many things coming up, so tune in, and hope to see you. And if you're dealing with hair loss, I want to tell you something. It is possible to regrow your hair. Yes, it is possible to regrow your hair. You just have to have the right information, okay? You just have to have the right information. So, see you. Bye-bye.